Operation Dudula, a controversial South African movement, has taken drastic measures by blocking healthcare services for foreigners. This action has sparked intense debate and raised serious concerns about human rights and access to essential medical care. Dudula, which means pushback in Zulu, claims to be fighting against illegal immigration and the strain it puts on South Africa's resources. The group's latest move targets hospitals and clinics, attempting to prevent non-South African citizens from receiving treatment. Reports indicate that Dudula members have been stationed outside healthcare facilities, intimidating foreign nationals and demanding proof of citizenship. This has led to numerous incidents where sick or injured individuals have been turned away, regardless of the urgency of their medical needs. The South African Constitution guarantees the right to health care for all who live in the country, regardless of nationality. However, Dudula argues that prioritizing citizens is necessary due to the overburdened public health system. Healthcare professionals have expressed outrage at these actions, stating that they violate the Hippocratic Oath and basic human rights. Many doctors and nurses have reported feeling conflicted, torn between their duty to treat patients and the pressure from Dudula supporters. The government's response has been mixed, with some officials condemning Dudula's actions while others remain silent. This lack of a unified stance has only fueled the controversy and allowed the situation to escalate. International human rights organizations have called on South African authorities to intervene and protect the rights of all individuals seeking medical care. They argue that denying healthcare based on nationality is a violation of international law and could have severe public health consequences. Dudula's actions have not been limited to healthcare. The group has also targeted foreign-owned businesses, informal traders, and even schools. Their members claim to be protecting job opportunities for South Africans, but critics argue that their methods amount to xenophobia and vigilantism. The movement's rise to prominence comes at a time when South Africa faces numerous challenges, including high unemployment rates, economic instability, and social unrest. Some argue that Dudula is exploiting these issues to gain support for their anti-immigrant agenda. Supporters of Dudula defend their actions, citing frustration with the government's inability to address illegal immigration and its impact on public services. They argue that South African citizens should be prioritized in a country struggling with limited resources. However, experts warn that targeting foreigners for exclusion from healthcare services could have dire consequences. It may lead to the spread of infectious diseases as individuals avoid seeking treatment out of fear. Additionally, it could damage South Africa's international reputation and relationships with neighboring countries. The healthcare blockade has also raised questions about the long-term implications for South Africa's healthcare system. Some worry that it could lead to a brain drain, as foreign medical professionals feel unwelcome and seek opportunities elsewhere. As tensions continue to rise, there have been calls for dialogue between Dudula, government officials, and representatives of immigrant communities. Many believe that finding common ground and addressing the root causes of social and economic challenges is crucial to resolving the conflict. The situation remains fluid, with reports of clashes between Dudula members and those opposing their actions. Law enforcement agencies have been criticized for their perceived lack of intervention. In some instances, as the debate rages on, the lives of countless individuals hang in the balance. Stories of patients being denied critical care have begun to surface, putting faces to the human cost of this controversial policy. The international community watches closely as South Africa grapples with this complex issue. The outcome of this healthcare crisis could have far-reaching implications for the country's future and its place in the global community. In the meantime, healthcare workers continue to navigate this challenging landscape, striving to uphold their professional ethics while facing pressure from all sides. The coming weeks and months will likely prove crucial in determining the future of healthcare access for all in South Africa.